Hey guys, it's Dr. Ryan, and today we're going to talk a little bit about testosterone replacement therapy and acne. This is an annoying side effect of testosterone optimization. However, there are ways that we can get around it. So I created a quick slideshow to talk about some of the ways that we can understand it better as well as treat it. So let's go into that. So testosterone replacement therapy and acne. Okay, so what exactly is acne? And why would you be getting it when you're on testosterone therapy, where you're optimizing your testosterone levels? Well, acne really refers, or the process of it really starts when there's a blockage in your hair follicles. And why would that occur? Well, hair follicles can get blocked by a couple of things. Most commonly, they are oil, dead skin cells, as well as bacteria. And the combination of all three over time can lead to inflammation. And TRT, it affects this because testosterone increases sebaceous gland sebum production or oil within the follicle. You can see here's a graph that illustrates that as your plasma total testosterone levels increase, your sebum excretion increases as well. And you can see going from 5 to 500 nanograms per deciliter, there's almost an exponential increase of sebum production. And this, of course, can have certain effects, acne being one of them. So let's talk about the different types of acne. Well, acne can be divided into two types, non-inflammatory and inflammatory. And non-inflammatory is obviously just a blocked hair follicle without significant inflammation, significant white blood cell aggregation or pus formation. And non-inflammatory would include things like blackheads and whiteheads. And we'll talk a little bit more, have an illustration about that in just a bit. The inflammatory versions, and this is more of a gradient, a continuum, because it tends to progress, you go from papules to pustules, nodules, and cysts, which are essentially greater accumulations of purulent matter, and which of course manifests in different ways. Papules being small raised bumps that are inflamed and can be red, where in a more extreme case, you can develop things like cysts, which are where the purulent formation has gotten significantly large. You have sac-like lesions. And in terms of diagnosis, whenever you hear someone say nodulocystic acne, which is a severe form of acne, which is kind of what you see in this individual right here, they just actually refer to where you're getting nodules and cysts together. And again, it's very painful, and it's really just a tremendous amount of purulence under the skin, leading to large raised bumps and just hard, tender areas. And here's another diagram kind of illustrating acne progression. So here you have a healthy hair follicle right here, and then you have a whitehead and a blackhead. Again, this is non-inflammatory, right? With the whitehead, the idea is it's similar to a blackhead, with the exception that the whitehead skin is still covering the hair follicle, right? So you start to develop some blockage here, oil, dead skin cells, bacteria. But because it's not open to air, it doesn't turn black. And really that's because of the presence when melanin is exposed, melanin which is found within the hair follicle, of course, and within that the conglomeration of the oil, skin cells, and bacteria, melanin is within there, and it oxidizes to turn black. And that you notice that when you have an open hair follicle, when there's still skin overlying it, you don't. And as a whitehead progresses, before, if the purulence still continues to grow underneath the skin, it can develop into a papule, a pustule. As you can see, the purulence is getting worse and worse, and over time to nodules and then cystic acne, right? So again, it's more or less a continuum. Now, again, of course, once the pustule or the papule is open to air, and the purulence is released, many times it will turn into a comedo, right? If there's still some residual blockage, because at that point it's open to air and the skin covering is open. So how would you treat it? Well, so there's a number of ways to treat it. Typically, in my practice, I just try to use the most benign therapies I can initially before moving on to more significant ones. My favorite is benzoyl peroxide. This is readily available. It's an over-the-counter agent. I like the 10% version. It tends to dry out your skin and it's bactericidal against Propionibacterium acnes. Um, you can also try azelaic acid. This again is keratolytic, so it tends to break down the outer layer of the skin and improve skin turnover. Salicylic acid is also keratolytic, and this seems to work well with non-inflammatory acne more than inflammatory acne. You can also use antibiotics. So I don't particularly use these that often. However, many PCPs will utilize them. Erythromycin and clindamycin are typically used topically right on the site of the acne, whereas tetracyclines, they might be used orally. I'm not the biggest fan of long-term oral use of antibiotics for acne, owing to the fact that there are side effects, particularly with the tetracyclines, photosensitivity, headache, but also they can tend to disrupt your gut microbiome and kill off beneficial bacteria such as bifidobacterium, lactobacillus, and potentially Saccharomyces, and there is a concern perhaps over time if you utilize it for a long period of time, it could lead to C. diff. Um, and again, I think there are other ways to get around it, which we'll talk about. It is a possibility if you have to. And then for severe acne, and this would probably require a specialist referral, so to a dermatologist, you have the retinoids. One of the more common ones is T-retinoin or Retin A, which basically they tend to work through many ways. One theorized mechanism of action is via acting on retinoic acid receptors and keratinocytes, and it causes keratinolysis. So you get increased cell turnover. Tazorac and adaptoline are other versions of the retinoids. Then, of course, you have Accutane, which is an oral version. These three are primarily topical. And with Accutane, it is quite effective, but it has a pretty significant side effect profile. So again, it does require treatment under a specialist, such as a dermatologist. What about some alternative therapy? So again, this is where I try to really put a lot of emphasis. Diet really makes a big difference in reducing acne. So really doing simple things like reducing saturated fats in your diet, trying to avoid simple sugars, trying to stick with lean proteins. There are many studies that have suggested that having a diet that's higher in simple carbohydrates and saturated fats and dairy can contribute to worsen acne. And here's one that actually looked at, it was actually Malaysia. I looked at a group of 44 young adults. And what they came across with was that cases that had significantly higher glycemic load tended to have much worse acne, and milk as well as ice cream was much higher in the cases who had significant acne vulgaris versus the controls. So there's definitely a correlation between your diet and worsened acne. And the idea behind this, when you look through the research, it seems that a diet of higher saturated fats seems to increase mTOR protein pathway production, which in turn leads to increased sebum production in sebaceous glands, which of course correlates to more oil and more blockages. And what's kind of funny is if you are on metformin, because by virtue of the fact that it seems to inhibit the mTOR protein pathway or decrease it, it could help with this. So in addition to that, just doing things like trying to focus on lean proteins that are lower in saturated fats, like chicken breast or lean turkey breast or egg whites, those things would be excellent. Complex carbohydrates that are not processed, and healthy monounsaturated fats versus getting saturated fats from red meat. So things like extra virgin olive oil or macadamia nut oil are likely to improve your acne if you're not already doing that. Now, if you're getting excess oils from your cosmetics or lotions, make sure to avoid it if you can. They're all non-comedogenic. So in other words, moisturizers that don't lead to the whiteheads and the blackheads, and then unfortunately to the papules, pustules, nodules, etc. Over time, the blockages that doesn't clear. And so try to look for non-comedogenic versions of these. And then finally, for those individuals that are really predisposed to large amounts of sebum production, showering twice daily can be very useful. I mean, obviously, just from a mechanical aspect, it clears off dirt and sebum, and it makes it much less likely that they're going to be clogged. What about supplements? Well, so there are some studies suggesting that the following supplements can help with acne. Fish oil. We're not really sure what the mechanism of action is for fish oil, but there have been several observational studies which have suggested individuals who consume fish regularly tend to have less acne. Zinc appears to be has anti-inflammatory effects as well as antioxidant effects as well as antibacterial effects, which can all help in reducing acne. Tea tree oil appears to work as well, and you would apply it topically to your the area of concern twice daily. And this appears to decrease the cytokine NF-kappa beta, which is really important in augmenting the inflammatory response. And then lactoferrin. So lactoferrin is a milk-derived protein, and it has antimicrobial, anti-inflammatory effects. 300 milligrams daily seems to offer some benefit in acne. Okay, then finally, you have supplements, you have drug therapies, you have dietary changes. What about just changing your testosterone replacement therapy? Is there a way that you can better adjust it to reduce acne? And I think there is. So number one, making sure you test your levels. So ideally, you want to keep your testosterone levels optimal, 9 to 1100 nanograms per deciliter for your total, and then free, you want to keep between 20 to 30 picograms per deciliter. Again, if as we saw, as you increase testosterone, you do increase sebum production. So if you're significantly above those ranges, there is a chance that you are likely going to worsen your acne. And so making sure that you're within those ranges and decreasing or increasing your testosterone, or typically it's decreasing your testosterone, so you stay within those ranges is going to be helpful. Some patients, unfortunately, even at 9 to 1100, they get really terrible acne. So sometimes we have to modulate them and decrease it down to where they still see the benefits of testosterone optimization therapy, but at the same time don't have terrible, terrible acne. And then one thing to consider is your dosing regimen. So there is a lot of variation in how providers treat patients with testosterone or with low testosterone, and some providers will do weekly or biweekly or even monthly doses. I'm much more a fan of doing daily dosing, daily injections, because it seems in my mind to keep your levels much more stable. And I have noticed when you use smaller doses, you tend to have less conversion to DHT as well as estradiol. And the concern, of course, more is with DHT, because it seems like the higher the DHT levels, the higher your sebum production. And this, of course, is just anecdotal. I've noticed in my practice, along with confirming with many other individuals who have large anti-aging functional medicine practices, they seem to see the same results. And there are a few articles that have suggested that daily injections can provide some benefit in terms of stabilizing your levels. And this is just one, but there were several. This is one looking at daily subcutaneous testosterone. And what they found in this particular article was by utilizing subcutaneous daily testosterone injections, they found that there's a significant increase in total testosterone, free serum testosterone, direct free testosterone in those patients versus those who had once weekly regimens. And I'll put a link to both of the articles I cited in the bottom of the description. Okay. Well, hopefully that has been helpful for you guys. I know it's an annoying side effect, but there are many things that you can do to improve your situation if you have pretty bad acne on testosterone. And some of this, hopefully this information has been helpful to help alleviate that. I'll see you guys in the next video.